for today is we want to be sure that you all start this year off with getting everything taken care of and organized so that you can move forward this year. I always found that it was really a good idea to stop, get your files together, get your records together, get a good plan going forward so that as things get busy, and we know they will, that you won't be digging yourself out of a hole. So those are the things that I plan to go over today. I am going to give you all a chance to ask questions at the end. I'm going to go through the presentation, and if you have questions, go ahead and make those questions on a sheet, and then when we get to the end, I'll go back and answer those for you. But as I said, I think it's a good time for us to go ahead and look at all of our operations and look at what we need to be doing in 2022 and every year. So I like to break things down into a logical manner. So what I've broken it down into today is we're going to look at your business operations, your overall operations, how you're getting things set up for this year. We'll look at the things you need to be paying attention to for your clients and also for your employees, because I always view this business as you're managing two very important groups of individuals. That is your clients and your employees. And there's always a delicate balance between those and making sure you have enough or that they're satisfied or whatever. So that's the way I always break this down. And of course, your business operations are always very important. They have to be efficient so that you're not spending time on things in the office when you can be getting additional business. So first, let's start with the business operations. Each year, you're supposed to do an annual agency quality assurance review. This is a good time for you to do that. There are some standard forms where you can, that have questions and answers on them, where you can fill it out the same each year. It goes comprehensive review of your agency. It looks at complaints, all types of things that your agency is doing, even the financial side of it. So you need to do that annual review. You should keep that in your file, because if you get a survey or an audit, they will want to see that. That's one of the things that they like to look at, to see if you have been doing it. And it will sometimes give them a target or a trigger as to the things they need to look at, because you'll target in that quality assurance review, you'll look at things that are going right or things that didn't go right. And you'll also address those as to how did you fix those or what was your action plan. So make sure you go ahead and get that started. Also, most of you have already done it, or you're still in the process of waiting for your new DHSR license. Make sure you get that. I always used to notice that sometimes it wasn't totally complete until like over into January, if it was time for you to renew. I think they're doing those online now, but just make sure you have a valid license and that you did renew your license, because you don't want to be operating outside of that. Each year, you're supposed to review your emergency preparedness plan. And we see coming up just this weekend, we're getting ready to have inclement weather. So you want to go into your emergency preparedness plan and be sure what do your employees do when we have inclement weather and your aides cannot go to work? What is the plan? What is the client supposed to do? If you have a total care client, I'm sure they have a caregiver. Of course, they would have a caregiver that would take care of them, but you need to, I would check in with that caregiver, the family caregiver, and be sure that they have everything that they need. Are there things that they're gonna need that you can help them with? Because the other thing as an agency owner that you always have to be concerned about is you have to make sure your employees are safe. So it is unreasonable to ask your employees to go out in the snow and ice and possibly get hurt to get to a client. So this is where you want to do things ahead of time. Those clients that you know that are vulnerable, check in with the caregiver. That is really good from a PR standpoint, and ask them, is there anything that you're going to need in case the power goes out? What do you need? Can we help you with anything? If you need to go to a shelter, will you have a ride? And then look at the resources that you can find for them to help them along the way. Even if they don't need your help, it gets them thinking about what they need to be doing to get ready for this. Sometimes we have power outages even when it's warm in the summertime. We get a hurricane. So that would still be a situation where you want to be sure that you check in with all your clients if you can. But the vulnerable ones, the bedridden, all of those, you need to check in with the family caregiver and make sure your employees are okay, because you want them to take care of their families and make sure that they have everything that they need so that they're safe, because they're people too. Your infection control, you should go in and review your infection control procedures and policies this time of the year. Is there something this year that you need to do differently? As we know, the recommendation now is an N95/KN95 mask. I do hope that you all are able to get those. They're saying that we're going to get them in the mail if we sign up. I'm not sure how that's going to apply to agencies, but just make sure that your employees have the protection that they need and seek out those resources. Sometimes your employees are also going to need maybe a gown, or they may need also a face shield with their mask. And I know this is a challenge. It can be expensive, but it's just very important right now because you want them to be able to keep working. You don't want to have your employees out sick. Since most agencies, probably all of you, are doing electronic visit verification, part of your policy should say that each year you're going to be sure that your employees know how to process the electronic visit system. It should be part of what you do when you bring those employees on and hire them, but annually, you should check with them and be sure everyone knows how to use the system, because if they don't document properly, it can affect your payments. And this is something you're attesting to in your policies and procedures. You should have an electronic visit policy. So review that also. When I was talking about the annual agency quality assurance review, you want to look at your staff's strengths and weaknesses. And one place you can find that is, if you want to know maybe what some of the weaknesses are, you should also have a complaint log. I hope your complaint log is empty. I hope there's nothing on it. However, if you have had some complaints, look at that and see if there's a trend. Is it just one person that's always getting a complaint, or is there something going on with your staff where you need to address or train them a little bit better? Look at that, and this is where you put your plan in place. And then your staffing strengths. You know, what is the strength of your agency? Is it that you have a lot of mature, secure employees that will go the extra mile for you? Are they just very well trained? They've been in the industry for a long time. Look at that and try to increase it if you can, and just create as much balance in your agency as you possibly can. As far as the clients, just a reminder, this is something that will slip by you. Every one of your clients needs an annual reassessment. You assess that client fully, the RN does when they come into your agency, but at least once a year, that reassessment needs to be redone. And sometimes you can miss it. Now, that reassessment, it doesn't have to be a year, because you're sending that nurse out there every 90 days to be sure that during the supervisory visit, they can do that reassessment at any time. But just be sure that you have a reassessment in your file for every client at least once a year. Also, I found that sometimes when the care plans were updated, or if I updated the care plans, sometimes you kind of mark over them and you change something, or, or even if it's in the system, you just go in and make a minor change. I would suggest that at the beginning of the year that you go in and make a new, fresh care plan that you're going to work with for the year, especially if you have it on paper. Just rewrite it, get it new and fresh, and then just continue it from there. That's just a good practice. One of the major infractions or deficiencies that agencies have right now is the care plans are not indicating the level of assistance that the client needs. And that would be, do they need just supervisory assistance? Is it extensive assistance? Total assistance? Those are in the rules and regulations. But every task that's on that care plan, RNs, it needs to say what the level of assistance is. And the reason it needs to be there is because that is looked at as far as who you have assigned to work with that client. So if a client has more than 2 ADLs that are extensive assistance and they have a cognitive impairment, dementia, whatever, they need an aid that's on the nurse aid registry. However, there's 5 ADLs, and if there's 2 of them that are extensive, but they do not have a cognitive impairment, you can use an aid that is not on the nurse aid registry. However, you should always make sure every aid is trained for whatever that client needs. Make sure they have the training that applies to perform the task. So please pay attention to this. If your care plans do not have a spot on there or a way to indicate how much assistance that client needs, you need to go back in there and fix that for this year. Just remember, all year long, every quarter, and it's not quarter, it is 90 days. Every 90 days, you need to do a client review. Client record review. That should be in your file. A client record review. There's certain things you check. You check the care plan, be sure that their tasks are being performed, all the things about a client. You should have a standard form for that so that everyone is the same. You should look at least 10% of your records. However, if you have an agency that has only 10 clients right now, you probably want to look at least half of them. I never did under 5, even when my agency was small, because that way you get to see if you have a trend. But make sure you get that documented and pick the individuals that are going to do it. With your RN doing most of that work, she's a great one to be on that client review team. Also, your administrative office assistant can be part of it. And if you have a separate or different agency director, it'd be good for them to be on there too. These are also reviews that you should keep and have those on file in case you get a review or a survey, because it's a good place for them to look as far as moving forward and to see how the agency is operating. Also, this time of the year, you want to look at, some of you have referral sources, people that refer to you constantly, or you refer back to them. You want to go in and look at your referral sources. On my initial intake form, I had a space on there that said something about where did the client come from or referred by. You want to keep track of that. And if someone is constantly referring clients to you, you want to make sure you stay in touch with them and thank them and let them know kind of how the client is doing. Just build a relationship around that. People love that. And one thing that your referral sources love is that when you call them back and let them know that everything is going well, they will send you more clients. Because one thing you never want is to assign someone or refer a client to someone and they not do a good job. It's really a reflection on you or the referral source. So let your referral sources know that you're doing a great job. Let them know if you're having problems or whatever, but just be mindful of that. It's a good way to build your business. Look at also what type of information you receive from your referral sources. Are you getting enough information to move forward with that client? Sometimes if a referral is called into you, you may be speaking to the RN or the staff person that called in that referral. Be sure that ask them to really be honest with you and tell you the things about the client that may not be on that paper. That's a great thing to do. And you be honest as well. So this may not be everything you need to do for your clients, but this will get you going and get you set moving forward. As far as your employees, every employee needs an annual evaluation. That is part of your policies and procedures. So this is a good time to set up a schedule as to when you're going to evaluate those employees. Most of them will probably not be due on the same day because they were hired at different times. It's just however you want to do it. But I always did mine on the anniversary date. If they were hired March 12th of 2021, then I'd do their evaluation in March. The other thing is when you do that evaluation, go back in and check the nurse aid registry. Now you all are aware, and I'll just reinforce that every employee that you hire, whether they're certified, not certified, or on the nurse aid registry or not, they should be checked in the nurse aid registry system because there is information in there about individuals that may have had an infraction or did something in the field. They weren't on the nurse aid registry, but if they have negative that happened, it's in that database. And when you check that database, there's a confirmation, print it out and keep it. So make that part of the evaluation because you all know that these employees may work for several different agencies. They work in the nursing home, they're working all over. So they may be fine at your agency. They never did anything wrong, but you don't know if something happened somewhere else. And usually that employee is not going to tell you that they've been precluded from working anywhere. They're going to try to keep the job working with you. So just be sure that you check it. Once a year, your employees have to redo certain parts of in-service training, the same training that you do when you hire them, TB, infection control, safety. You don't have to redo the orientation, but there's some mandatory in-services that they need to do. And doing those at the time of the evaluation is an excellent time to do that. One of the things that I've been reading is that employees that are given goals, career goals with their company, be it healthcare, whatever, even AIDS, they are more apt to work well and stay with that company. So there are some very minor things. You're probably thinking, what can I do with an aide as far as career? There are some aides that work for you that are just great at giving a bed bath, or they're just really great at assisting clients with certain pieces of equipment, or Hoyer lift or whatever. You can actually have that employee to transfer that skill to other employees. You'll say, we're going to get together, and Jane, who is very good at, taking care of a bed patient, she's going to show us how she does that. That would mean a lot to them, that you respect their education, you respect what they're doing, and just small things like that are just really, really helpful. If you have other types of recognition for your employees, one thing I used to do was I would have an employee of the month or employee of the quarter, and you can attach a small monetary gift to that, and we would do a little write-up about them. Of course, you don't put patient information in there, but you would put something in there about that, they showed up for all of their assignments and they took on additional work and whatever, those good things that you want to put out there to make your employees feel good and valued. Sometimes it's not just the money. People want to know that you respect them and that you really care about how they help. I want you all to plan ahead. You need to have some goals for your agency. Most of you, your goals right now are probably to staff all of your clients. I know there's many, many clients out here right now that need help, and we just don't have the staff for them. So establish a goal to staff every one of your clients, and you need extra. If you have 10 clients, you need more than 10 aides because someone is going to have to be out for some reason. So you want a good padding so that if someone is out, you have people that you can pull from. But whatever that goal is, if you want to get to 50 clients, put a plan in place to accomplish that goal. If you don't get there, at least you're on your way, but you want to keep your goals in front of you. I do hope that every one of you has a business plan that you're working from. And if you have a business plan, go back in and review it and make sure that it's up to date, that it includes all the things that are going on in your agency. If you do not have a business plan, I would suggest that you prepare one. If you were in business last year, you have some numbers already that you can look at, but there's more than just the financial in the business plan. It's what is your marketing plan? Who is your competition? There are many, many agencies that have come into the business in the past year. There are some buildings here in Raleigh where there may be 4 agencies in there. So how does that affect you? What are you going to do when competition comes along? But I would say that the best thing you can do for competition is to do a great job with the clients that you have. Be very, very, very responsive to your family caregivers and to your clients. If they try to get in touch with you, you get back to them. And if it's not in a timely manner, you need to apologize. But if your client calls you or even your employees, you need to get back to them immediately. So make sure you have plans in place to address all of the goals that you have, and you should definitely have goals. If there are those of you that need help with a business plan, we can help you with that. But I just believe that you should have one. When I started my home care agency in 1999, I spent 4 months putting together a business plan. I was working full time, but that business plan was the reason for my success. Because as I put that plan together and I thought through it, I saw the roadblocks that I could run into. I kind of had a plan and I always knew where I was. So had I not done that, I don't think I would have had the success that I had. So I am a big business plan proponent, and I encourage all of you to get one in place or revise the one that you have, especially at the beginning of the year. And that's basically what I have prepared for you all today. So if anyone has jotted down a question, or if you have a question for me right now, we can go ahead and discuss that at this time. Just open your mic up and go ahead and speak if you have something. Yes, but you need a business plan. All of you do. It's just really, it's going to help you in the long run. For sure. I know there's so many, even in all types of businesses. I am a counselor with SCORE also. And I run into all of these businesses. They've been out there 4 or 5 years and they don't have a business plan. And it kind of shows, but it's never too late to put one in place because it will help you. Yes.
Hello, my name is Bola with Abba Home Healthcare Solutions. Patty, thank you for inviting me. This is my first time of joining. My other partner is here with me. Her name is Edith. Our question to ask, I'm just throwing this question out there. We've been getting clients for skilled nursing that needs PTOT. Our situation is that we couldn't find PTOT, like therapists to do the therapists for them. So this way we are losing clients. So what do you suggest we do?
Well, what I've noticed here, Bola, is that there are a number of private PTOT agencies that do that. Mm-hmm. And so you may want to partner with them. Find those PT agencies that contract their services out. And that would be the best way to do that. Other than that, you'll probably have to hire someone. And I'm sure, that's difficult. Most of the physical therapists and occupational therapists, they have their own businesses or they do that on the side. So try to partner with them. Does anyone else have any suggestions there? But that would be my suggestion. Find someone that you can work with, partner with them, get a contract with them, and work out how you will pay them or how they will compensate you in some way, but just partner with them.
Okay, thank you.
Mhm. How are
Hi,
you
Ms.
all handling your, go ahead, you go ahead.
I'm sorry. Hi, Ms. Williams. I just have a question. I'm actually in the process of being licensed. So my question is, with new home cares, what payroll software do others use in the beginning?
Well, I have a couple of clients that are using ADP. When I was running my agency, I always used a CPA or accountant to keep my books. And one thing that they did for me was they did my payroll as well. So that's another option if you have a CPA. And for me, that was really important that I have a CPA. I did not want to know how to be an accountant. I did not want to keep track of that. I knew I had to be a nurse. I had to be a manager of a business, and I wanted to spend my time doing that. So that was one of the things, I quote, splurged on, was I got an accountant to handle that part of my business. So that's a couple of options for you. Okay, go ahead and open your mic and speak.
Hi, Patty, it's Myrtle again. I have a question because I'm being told different things for different states, and I don't know what North Carolina is. Like, because I'm just trying to start out, and you don't have a lot of money in the beginning to invest. So they telling me, like, for the software, like for scheduling, for the staff to clock in and out, for documentation, that it has to be a software that does it, that I can't do it manually. It can't be done manually. Is that true?
Okay, so what I will say is in the state of North Carolina, if you're going to do Medicaid, and are you planning to, Myrtle? You are?
Yes, ma'am.
Okay, so you do have to have a software for your electronic visit verification that I talked about earlier. In North Carolina, Myrtle, there is an agency, an organization that the state Medicaid system has chosen to do that. It is called SANDATA, SANDATA. You can sign up with them for a portion of what they do for you as far as electronic visit. It is no charge as far as I know right now. And Shanice is here, I think. Shanice, I want you to back me up on this. But you can sign up with SANDATA and they will do your electronic visit. They have many features in their program and you probably can buy additional features from them. But this is my advice to you all if you're starting out with limited resources. Learn how to run that business with good organizational skills and try to run it without getting expensive software systems in the beginning, because you have a lot to learn. You are low on resources and you can hold on to that money for a while and wait until you figure out what you're doing with the business. Try to do things manually. If you only have 10 clients or 15 clients, you can do that manually. You're not ready for a software system. But however, if you come into this business and you've got $90,000, $100,000 in the bank and you can add all the bells and whistles and paint and flags and all that in the beginning before you get clients, by all means do that. That was not my situation. I had to do everything as efficiently and as I could without spending the money until my business got to the point that it made enough money to sustain all of that. That was the way I did it. So as I said, if you're going to do Medicaid, SANDATA is there. You can look into that. There's features that they will provide for you that are no charge. That's the best way to do it. Then you can add things on, but do as much as you can without getting signed up for all these expensive packages before you really have learned your business and started seeing that it's successful.
Okay, thank you, Patty.
Thank you. I was about to ask a question about PPE. Will anyone please talk about how you're doing on PPE right now? Do you have a sufficient supply? Are you having challenges with that? Would anyone like to share around that? Okay, I guess that means that everyone is okay, because now we know that they need a really good mask. And I'm hoping that you all are able to get those and that you've stocked up, because we thought things were getting a lot better. And now that's questionable. So I hope everyone has what they need to move forward.
So Patty, just a question for the PPE. As you know, I haven't started an agency yet. I'm just in the process. So do the agency pay for all the PPE?
Absolutely, you do. That is one of the costs of doing business. Unless, now, sometimes there's organizations in the community that will help agencies and they will give away masks or whatever. So you want to definitely tap into that if you can find it. But you should supply PPE for your employees, your gloves, your masks. When I was out there, basically, we just had to supply gloves and gowns if they, were needed in case there was a situation that someone had something that may be contagious. But now you have to supply the PPE. That is a cost for the agency.
Right. Okay, thank you.
What happened? Any other questions about anything that I covered today?
As far as onboarding, can you just do a quick overview of how that should look?
Okay, as far as hiring someone for the first time?
Yeah, I'm just a little bit like confused on, okay, do I run the background first? Do I have them drug tests, or I'm just confused about what are the steps to do first. That's all.
Okay. So basically the way you can handle that is if you have someone come to your agency or you run an ad and they say, I would like to get hired. Before you, of course, you don't know really who they are. They need to come into your office or wherever your paperwork is and fill out your paperwork. The first thing you want from them when they show up, well, when you first talk to them on the phone and they say they're going to come in and fill out an application, you let them know, I will need you to bring your driver's license, your social security card, and your most current TB skin test or screening. And once they come to your office, hopefully you will have an employment packet with all of the things they need to fill out. If your stuff is not online and you're still doing things the manual way, trying to build up, you have that packet, you give that to them, and they fill out everything on there that you need. And then you interview them or whatever. The first thing that I would do, which is easy and free, is go straight to the Nurse Aid Registry, the ncnar.org, to check to see if they're on that registry in any way, positively or negatively, or if they're not on there, that's a good thing. If they're not on the registry and they're not there, and print that out. That's one thing you can do right up front. Now, as far as the background check, if you're doing your background checks yourself, you may not want to do that right at that moment because you want to interview them. But you will need to get the background check done once you see that it's someone that you're interested in. Of course, the other thing I did was when they came in to fill out their application, I had an orientation manual. I would have them to go through that. So they're doing their in-service right there. They're doing the in-service, looking at TB, infection control, all of those mandatory in-service trainings. That was part of the initial hiring. I would let them know when you come to fill out your paperwork, plan to be here about an hour or longer if it takes them longer to take the test. So then basically you've done mostly everything they need to do. Be sure they sign everything. And then after that, that's when you do the background check, have your nurse, if you're not the nurse, to do their skills validation. Since I am a nurse, during the interview, when I interviewed them after they took their test and went through the orientation, I basically went through their skills assessment right then. I made sure I knew what they could do, what they had strengths in or weaknesses or whatever. So you'll be able to get that process together and go through it. pretty quickly. But then you've got this full packet of information on that client, on that employee, and you just keep processing it. The background check you do have to do if you're not doing it online and you're sending it to the SBI or whomever. If you're sending it off to someone, you need to do that immediately. And your application should have a statement on it that says, should we uncover something about you that is not in line with our policies or whatever, you can be terminated. Because sometimes you have to send people to work pretty quickly. And that's why it's important to have a good pool of employees, but just make sure you have a checklist and that you make sure every employee fills out every piece of paper so that you're not caught where someone didn't complete part of whatever your audit procedures are. Nicole, does that help?
Absolutely. Thank you so much. I just written down a whole bunch of stuff. Thank you. I've just been it's overwhelming. But that really, it really helped out as far as that goes. That's awesome.
Okay.
And one more thing, the drug test. When would you do a drug test?
Okay, the policies of North Carolina for home care services does not require drug testing.
Mm-hmm.
It is not required prior to hiring them. You can do that as an agency. And if some of you on the line want to, say how you do that, but that is not a required test. The way that I did it, according to my insurance, I had my employees to sign a statement when I hired them, and it said, if you have an accident, you will be drug tested. If you say you hurt your arm or you fell or whatever, when you go to the doctor or whatever, you will be drug tested. But that is a drug test is not a requirement. They are expensive. And so as an agency, you have to really watch your expenses, and you really don't want to be doing things that you don't have to do, especially if it costs money.
Okay, absolutely. Thank you so much.
Anyone else have any input on that?
Not necessarily input, but I do have a question.
Okay.
Okay, so my question is, if I already have some documents that's already that I already kind of made and stuff, could I come to you for consulting so I can just, just make sure that these documents is up to standard, and then, and get a little bit more assistance with creating other documents and business plans as well?
Absolutely. Absolutely. We will certainly help you with that.
Okay.
I have a question. Now that we are in the times of COVID, how are agencies now doing employee orientation?
Okay, does anyone want to address that? Yes, Shanice, will you?
Hey, yes. We do employee orientations online. So we do like a Zoom call. And we go through our orientation that way. Whatever we have to do in person, we complete most of our orientation online and then have them come in person. But that's how we're doing it.
Thank you.
You're welcome.
Yes. Anybody else have any input there? Because I tell you, there is nothing like seeing that person face to face and seeing their mannerisms and the way that they move. Those of us in healthcare, we pick up a lot from that.
Mm-hmm.
And
What
so,
I would do is it would be like partial online and then partial in person, like all the things that you can possibly do like online, let them do it, but also bring the person in or the people in to actually do like a skill check off, and that's what I would do. I think that would be the best suitable way to kind of be able to verify their skills, but at the same time, it decreases your chances of actually getting affected with COVID or any other, viruses and stuff.
Absolutely.
Thank you.
I'm pretty sure most people are doing a combination. Anyone else have any input on that?
Based on what Adrienne was saying, I actually did write down the combination, but I wasn't sure if that's how others are doing it since I'm in the process of being licensed.
Mm-hmm.
Thank you.
Well, what you want to do is you want to be sure you feel comfortable with the people that you're hiring. There's a lot you can do online, but you also I want to see that person. And just kind of get to know them and get a feel for them. So the combination sounds like it's a good thing for right now. Any other questions that you all can think of today?
Yes. My name is Edith from ABBA Home Healthcare Solutions. You mentioned a registry to go to while trying to employ a staff that we can go look and check their background or whatever. Can you repeat the registry again, the name of the registry to go?
Yes. Now, you all are not in North Carolina, correct, Edith?
Correct. We are in Maryland.
Okay, so I was giving them the one for North Carolina, and that's the only one that I'm aware of. But for those of you that may have that question, it's ncnar.org, North Carolina Nurse Aid Registry.org.
Oh, okay.
So Edith, you probably have something like that in Maryland.
Is it the same thing as Maryland Board of Nursing? That's where
Well,
you check their license?
Yeah, we have a board of nursing and we have a nurse aid registry. Now yours may be in one place.
Okay. Okay. I'll look up. I'll be on the lookout for that.
Okay. All right.
Thank you.
How many required in-service hours? Is there a minimum requirement?
The requirement is
like
what your
retraining?
agency, your agency sets the number. And for some of the policies that I've been doing in the last few months, you can say as low as 2 hours is all that's required, and that'll get all of your mandatory in-service in. But if you're going to do other things like I used to get my employees CPR certified every other year. So right now I'm seeing most policies are saying we will do 3 to 5 hours per year and that each employee will have that. But it's what the agency sets. But I don't see where you could do less than maybe 3 hours, 4 hours and get everything in. And you need to be sure you get that in on all of your employees also.
So your employees have to be, your home health aides has to be CPR certified?
They don't have to be, but I always felt that as an agency, if I was going to have aides out there working, I wanted them to be CPR certified. And that was something that I did for my employees. And I used the American Heart Association because it lasts for 2 years. It used to be that of the Red Cross, American Red Cross was 1 year. And so I'm not sure if that's the same, but I know with the American Heart Association, it will last for 2 years. And I offered that to my employees. Every other year they would come in. I contracted with someone to do it. And it was just my comfort level. There is nothing in the policies and procedures in North Carolina that says they have to be. It's whatever you write into your policy.
No, I totally agree. Thank you.
Mm-hmm.
Hi, Miss Pathy.
Hi.
Another question is, we are also into REM, that's pediatric nursing. Do you have an idea of pediatric nursing too? You know that in Maryland, that's a separate agency apart from RSA, which is the residential agencies. I don't know if you have knowledge about that too also.
Well, here in North Carolina, if you're an in-home aid agency, you can do pediatric clients as well under one license. So are you saying you have to have a separate license?
Yes, you have to deal with clients who are under 0 age to 18 years of age.
Okay, the way that they do it here is we have a program called the CAP Community Alternatives Program, and that is those clients that actually qualify to be in a nursing home, but they are at home. So yes, they do have that divided up by age. There is a CAP C for children, which goes up, I believe, to age 21. I may be a little wrong. I'm not sure if it's 18 or 21. Yes. And then CAP DA picks up from there for the adults. Yes. But you still have the same one license, but you can get qualified to do either. when we go into, say, into Medicaid to indicate what services our agencies are going to offer, there's a way that you can say, we will do ages 0 to 120 or 18 to 120 or whatever that is, but there is not a separate license for that here.
Oh, okay. In Maryland, it is 2 different licenses. That you have. You cannot get the pediatric license if you are not RSA licensed.
Okay.
If you don't have the level 3, which is the home health agency, you cannot get the pediatric license.
I have another quick question. This is do you know the penalty that you'll receive, or the agency will receive, if they fail to turn their address change in within 30 days?
Well, I don't know the penalty, but you are supposed to notify them within 30 days. And so I'll just say this, do the best that you can to notify them. And I guess one way that they probably would find out is, say, if they were coming to your agency to do a survey or an audit, and you had an old address in there, and then you had moved somewhere else down the street 3 months ago, then that's how they would find out. But other than that, I don't know how they would, but try to follow the rules and give them your information as quickly as you can. If it's 36 days or 45 days, just go ahead. And I believe you go into NC Tracks and change that, but just make sure that you do it. All right. Well, you go ahead. Go ahead.
Hi, Patty. It's Karima. Thank you for inviting me.
Mm-hmm.
I'm new to home care. I haven't even received my license yet, but I hear a lot of people saying that I need a van or transportation. How important is it that I have transportation for the clients? And
You are in North Carolina?
No, ma'am, I'm in South Carolina.
Okay, so you're going to do private clients or Medicaid clients also?
I'm going to do private and Medicaid, yes.
Okay, so I'll just speak to what I know. Here in North Carolina, if you're doing Medicaid, there is no transportation that's part of the personal care services. That's not part of the service here in North Carolina. However, if you do private pay, you can, and most of the time it's required that you want to be able to transport your clients. So it's just up to you, because if you're competing with those companion agencies that are private only, that's one of the big things they do, is they have a ban. However, you can start without that. You don't have to have it. I wouldn't make it a requirement up front. And then today, you all, to me, I see it as a lot easier. Now, when I started in 1999, there was no Uber, there was no Lyft. But today you have those services available to help. So it's a lot easier than back then. Either, you had to take the client or use their car. And what I used to do is, on an exception basis, I would allow my aides to transport a client, but I had to know each time they were transporting them. I wanted to know that my aide is on the road with a client in the car, because for my insurance purposes, I wanted to know about that. I didn't want them to just think that they could show up at the client's house and they're going to take them here and take them there, because I was liable for that. So it's a liability. So just look at it from that standpoint. But if it's what your competition is doing, you may have to do it. However, as I said, those of you in North Carolina, if it's a Medicaid client, it is not covered and it is discouraged. Get them to use Lyft and Uber. You have that now, and that is the best thing. All right. Thank you all so much for coming. It's been a really good session. I wish you all the best of luck this year. We do this each month on the second Friday at 1 p.m. And I did record today, so I'll try to get the recording up on YouTube for those who weren't able to come, or if some of you want to watch it again, just let me know. But it'll probably be a few days before I can get it done. But thank you all.
I do have one question.
Yes.
My question is in regards to transportation. because I do know if you have like a vehicle and if it's up under the actual agency name and stuff that, you know, you will have to make sure that everything is running properly with it, like the insurance and coverage and everything. But is it a way to kind of like make sure that, you know, because let's be honest and stuff, you know, the CNAs or, you know, whoever the companions, respite care people going to be actually traveling to the patient's homes. Can we make it a requirement for them to make sure that they have insurance, like car insurance, and just make sure that they are held liable for any things that happen instead of, you know, everything being placed on you?
Okay, so the insurance that I had, if we were going to transport people, they made sure that we checked their driver's license and checked their driving record. And of course, you would want, if you're going to allow them to drive their cars and take patients around, you would want to make sure that they have insurance. But if they're on your job and they're driving that client, their liability may be in there, but yours, Adrian, is going to be in there too, because if it was on their hours. So as far as the client, if the aide is on the way to work and on the way home, that's not on you as an employer. But even when the aide travels from one client to the other, you can be liable in that instance if they get hurt.
Okay.
And we know that people are very litigious nowadays. They will sue you. Some will, some won't. But you do, if you have people out there driving, you do want to check their driving record. And some of you, your liability insurance is going to tell you, in order for us to insure you, you need to do this, 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 and this. And you'll see that when you get your liability insurance. And I'm sure some of you have run into that already.
On the licensing checklist, just want to clarify, is the competency verification for the aides, is that the skills test, like your in-service orientation skills test?
No, this is different. The competency is a separate checklist that you would have that addresses skills like, can they do a bath? Can they do a shower? Do they know how to transfer? All of those things that you feel are pertinent that an aide or an in-home caregiver would need to know, that is a separate checklist that needs to be part of every employee's file, as well as that orientation that we talked about. It's separate, and you'll have to verify that on each one of your employees that's providing care.
Okay, so that is a test. Okay.
They're supposed to, quote, demonstrate that to an RN. So an RN is supposed to watch them up to some extent. You know, you're not going to be able to watch everything. So some things you can say, how do you do such and such? And they'll talk through it and you'll know whether they know or not. But the rules and regulations say they demonstrated it in some way.
Okay.
All right, it's 2:00, you all. So we need to go ahead and get off. I don't like to go over. If there's questions that any of you have for me, you know how to get in touch with me. I put my email in the chat. You also got an email from me to notify you of this meeting. Just email me and we can talk offline or set up a meeting. Thank you all so much.